Hello.
Oh, hi.
Hi. How are you doing?
Well,
Good. My name is Lindsay. I'll be your nurse practitioner today. I'm going to do a total head-to-toe assessment on you if that's okay. Great. While I'm talking to him, I'm doing a general inspection of his head to toe, as well as his posture and his breathing. If you're okay with me doing an assessment and you have already emptied your bladder, can you please go ahead and put a gown on?
okay.
Great. I'll give you some privacy. You ready?
Yes.
Perfect. Okay, I've already checked your vital signs as well as your height and weight. First, I'm going to start by a general inspection of your skin. I'm going to start with your head and your face. I'm going to inspect your skin, the pigment, moisture, the skin tuber. It would appear that your skin has some good form. There doesn't appear to be any lesions present. Ears are both symmetrical as well as eyes. And we check the temperature. The skin feels nice and warm as well. I'm going to go ahead and look at your skull while I'm talking to you some more. And then I'm going to go ahead and do a total neurological exam. Is that okay with you?
Yeah.
I'm going to start with cranial nerve 1, which is the olfactory nerve. And that is tested using the sense of smell. So I'll take a candle or some coffee of some sort and ask you to please occlude one of your nostrils. And if you could try to smell. Can you smell?
Yes.
Good. Can you occlude your other nostril and smell?
Yes.
Okay, great. And I'm going to do cranial nerve 2 next. It's the optic nerve. And I'm going to have you occlude one eye, cover one eye, look straight ahead. And I'm going to wiggle my finger in 4 different quadrants and let me know if you can see it.
Yes.
Good.
Yes.
Good.
Yes.
Good.
Yes.
Good. And switch eyes. I'm going to do the same.
Yes.
Keep looking forward.
Yes. Yes.
Good. Next, I'm going to do cranial nerve 3, which is the ocular motor nerve, and I'm going to check your movement, if you could follow my finger. And I'm also going to check cranial nerve 4 at this point, which is the trochlear, which is down and in. Next, I'm going to check your trigeminal nerve, and I would use a cotton wisp for this, but as I don't have one, I'm just going to use my finger, and I'm going to check the sensation in your forehead, your cheeks, and your chin. You feel that?
Yes.
Good.
Yes. Yes.
Good. And can you also clench your teeth? Good. Perfect. Next is the abducens, and I'm going to check that by having you look side to side with only your eyes. Good. Okay, and the next cranial nerve is cranial nerve 7, and that's your facial nerve, and I'm going to ask you to please smile and relax. Raise your eyebrows and relax. Can I have you puff your cheeks out? Good, relax, and clench both eyes tightly. Good. Next is the cranial nerve 8, which is the acoustic. I'm going to do a test next to each ear and let me know if you can hear it.
Yes.
Good.
Yes.
Good. Cranial nerve 9 is the glossopharyngeal, and I will check that by having you speak. You've been speaking with me, and I haven't noticed any dysphagia or aphasia or any difficulty with your words. The next nerve is cranial nerve 10. That's your vagus nerve, and it's dealing with digestion. And when was your last bowel movement?
About an hour.
Okay. Do you have frequent bowel movements daily?
Yes.
Do you have any issues that you are concerned of right now with digestion? Good. Cranial nerve 11 is the spinal accessory. And it is checked by having you do a shoulder shrug. Can you go ahead and shrug your shoulders? Good. You can relax. And last is cranial nerve 12, and that is your hypoglossal. I'm going to have you stick your tongue straight out and wiggle it back and forth. Good. Okay. Now I'm going to palpate your scalp and hair as well as your facial bones, if that's okay. Okay. All the bones in the scalp are fused. There appears to be no lesions in the scalp. And the hair is soft and moist. I'm going to palpate your facial bones and your temporomandibular joint. Can you slowly open and close your mouth? And close. Is there any pain associated? Good. Okay. I'm going to look at the external characteristics of your eyelids and your eyes, as well as your eyelashes. All of eyelashes seem to be intact. Eyes are symmetrical. Your sclera is clear. It's got a little bit of a red tinge to it, but I believe you're just tired. I'm going to check your conjunctiva. I'm going to pull your eyelids down just a little bit. Good. Your conjunctiva is very pink and moist, which would help prove that you're not anemic or anything at this point. I am then going to palpate your lacrimal gland. Good. And I'm going to palpate your sinuses. Let me know if there's any pain. Good. Normally the forehead is only palpated if there is pain in the cheeks, but I'm going to go ahead and palpate it anyway. I'm going to assess your pupillary response. If you could look straight ahead. Good. Pupils are equal, round, reactive. They're brisk and they accommodate. I am next going to check your red reflex with the ophthalmoscope. If you could sit straight next to me, turn towards me. Thank you. Okay. I'm first going to inspect the red reflex. And I'm going to look at the fundus, the nerves, the optic disc, and the macula. Perfect. I'm going to inspect the red reflex with this eye. The nerves, optic disc, the optic nerves, the macula. Perfect. Okay. Next, I'm going to inspect your nose. Place this inside. I'm looking at the hair, position of the septum. We already determined the patency of each nostril, the mucosa, and the turbinates. We'll check the other side. Same with this side. Okay, I'm also going to now check your mouth and pharynx. If you could open your mouth. Great. I'm going to inspect the lips. They're moist, there's no cracks, no lesions. The soft palate and the hard palate. You lift your tongue, the floor of your mouth, no lesions. Your teeth, the characteristics of your teeth, the color, the number. Place your tongue down. The anterior pillars, the uvula, tonsils, posterior pharynx, and note any mouth odor, none of which I'm noticing. Okay? I'm also going to test your gag reflex with a speculum, but I don't have one. So I would place that in the back of the mouth if I did, and it would cause you to gag a little bit. And I would hold your tongue down and ask you to say ah while I was looking back at the back of your throat. Say ah. Good. I'm then going to test your visual fields. if you could look at me, I am going to hold up fingers and just look straight ahead on any point, and I'm going to ask you how many fingers I'm holding up, okay? Good. Look straight ahead. Okay. Good. Okay. Good. And I'm going to assess your extraocular eye movements. You can follow my finger. Let me know if you notice any double vision. Okay. I'm next going to inspect your neck and thyroid. The trachea is in line. The thyroid doesn't appear to have any nodules. I don't notice any jugular vein distension. And everything seems to be symmetric. I'm going to do a passive and active range of motion. Can you relax your head? Good. Good. If you could touch your chin to your chest, your chin to each shoulder. Good. And look straight back. Can you touch your ear to each shoulder? Good. I'm going to check your carotid pulses, each separately. Good. Good. I'm going to check your lymph nodes. 3 auricular, post-auricular, occipital, tonsillar, submental, submandibular, posterior cervical chain, deep cervical, supraclavicular. Good. I'm going to check the inside of your ears now. I'm going to pull back and up with your auricle. And I'm going to check the inner ear. And the temporal membrane. It should be pink or gray. There should be no swelling, maybe some small hair, maybe a little bit of cerumen. That's normal. I'm going to check this one as well. The same with both ears. Good. Okay. I would assess bone and air conduction with a tuning fork if I had one. I would strike the tuning fork and place it near the mastoid bone. I would ask you to let me know when the vibrations are no longer heard. And then when you tell me that they're no longer heard, I would bring them towards the inner ear and ask for the same. I would do this bilaterally. And then to test bone conduction, I would strike the tuning fork and place it on the center of the head and ask you to let me know where the sound is heard. If it's heard to the right ear, to the left ear, or bilaterally. I would also palpate your auricles for any lesions or any sores on either ear. Neither have them. Okay. Next, I'm going to listen to both your carotid and your thyroid gland. If that's okay with you. Can you sit up for me? Good. Okay. Now I'm going to look at your upper extremities. I'm going to look at your hands, arms, biceps, and shoulders. I'm going to look at the capillary refills in both. Good. There's no edema. The muscles seem to be good and intact. I'm going to assess your radial pulses and your brachial pulses. Good. And your clavicular and your axillary lymph nodes. Good. I'm now going to listen to your breath sounds. I'm going to inspect your respirations visually and the appearance of the chest. I'll palpate the pericardium. I would locate the apex and feel for pulsations or heavings. I'm going to go ahead and listen to your anterior thoracic. Deep breath. And out. Deep breath. And out. Deep breath in. And out. Deep breath in. And out. Good. I'm going to listen to your heart so you can breathe normal. Aortic. Pulmonic. Herbs. Tricuspid. And mitral. I'm going to listen to your bowel sounds so you can continue to stay relaxed. Okay. I am going to have you take a deep breath in and out. And I'm going to, as excursion, I'm going to test tactile firmness in the front. Can you say 99?
99.
Good. 99?
99.
Good. And 99?
99.
Good. Okay. I'm going to okay. If you could turn to your back, face the wall. I'm going to assess the costovertebral angle right below the ribs and test lung expansion. Can you take a deep breath in? Good. And out. My thumbs move symmetrically, so that is good. I'm going to check for tenderness back here. If you could let me know if you feel any tenderness.
I feel no tenderness.
Good.
I feel no tenderness.
Good. I'm going to percuss back here. And lateral. Good. I'm going to listen to your posterior chest. You can take a deep breath in. And out. 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 And your lateral chest. In. And out. In. And out. In. And out. Good. Okay. And now I'm going to go ahead and ask you to lay down on the couch. I'm going to observe your abdomen. I'm going to look at the contour, check for any pulsations or heavings, as well as the color and the texture. There are no pulsations or heavings. Contour is good, color is good, and texture looks good. I am going to listen to your arteries of your abdomen. I'm going to listen for the aortic. renal arteries. Iliac arteries. And femoral arteries. Okay, good. I'm going to palpate your abdomen. I'm going to start with percussion. Noting the dullness to find the liver borders. It gets dull about the 5th intercostal space. We'll do the same on the spleen side. And I shouldn't get any dullness on that side, and that's good. I'm going to lightly percuss. You take a deep breath in. And hold it. Okay, you can breathe out. I'm going to deeply percuss. Can you take another deep breath in? And hold it. Okay, you can breathe out. I'm going to do the same with the spleen, except I'm going to let the spleen do the work. Deep breath in. And hold it. Okay, you can breathe out. In. And hold it. Out. And with the spleen, you want to start from the right lower quadrant normally and go over, because if the spleen's going to be enlarged, that's how you would find it. You don't want to miss a enlarged spleen. You also don't want to deeply palpate, because that you're not digging for gold, and you don't want to risk rupturing the spleen or injuring it. Okay. Let's see. Next, I'm going to inspect the lower extremities. I'm going to look at the hair distribution on the legs. I'm going to look for any edema. Okay, there's no edema in the legs, no tenderness, the muscles are in good form. I'm going to assess the dorsalis pedis pulses, bilaterally, tibial pulses. If you could bend your right knee. I'm going to assess the popliteal. And this leg, the same. Good. Okay, I'm going to test your reflexes. You're going to do your knees, knee reflex. Normally your leg would be hanging, and the knee would kick. And this knee will be the leg hanging from the table or chair, and the knee would kick. I'm going to check your Achilles. Can you bend your knee? All right. I'm going to support the heel. The foot should press down. Bend your knee. Press the Achilles, and the foot should press down. Can you sit up? Okay. Can you place your thumb towards the sky? Good. I'm going to assess your radial. Good. Can you see this one? Okay. Okay. Do you have any questions for me? The last thing I'm going to do is test your muscle strength. Can you squeeze my fingers as hard as you can? Good. Put your hands straight out in front of you. Try to lift them. Don't let me push them down. Okay. Try to push your hands down and don't let me pull them up. Good. Can I see your feet? Pull your feet towards you. Lift your feet. Good. Step on the gas. Good. Okay. Testing muscle strength. All right. Do you have any questions? Yes or no? Okay. Thank you.
Something.